Unfortunately, there is no t-shirt that says one size fits all for multiple sclerosis. So if you see patients with multiple sclerosis, there is an enormous variability in disease activities, enormous variability in how impactful with respect to disability the disease is. And there is also an enormous variability where sometimes we see somebody that has quite a number of lesions on their brain MRI when we check. And if you see them, you would think there's nothing wrong with that person, versus sometimes we have an individual with very few lesions that is very significantly impacted by multiple sclerosis. And so what this little discourse that I just gave you gives you is the flares that there is an enormous breadth of how MS patients present and how they behave. And that's in part also why we don't have algorithms, because of the very great variability of the disease. We know that probably there are genetic drivers for these different behaviors, but these are not genetic drivers that are based on a single gene. Probably they are based on gene families and modified by the environment. So when I think of patients with multiple sclerosis, it is really the point that that I look at a patient and think of, based on their initial presentation, how many lesions do they have? Do they have involvement of one or more neurological system at the initial presentation? Are they recovering from an initial attack? All of these aspects go into a consideration where I will think about how likely is this patient, in my opinion, gonna be at risk for rapid progression. And the higher the risk is, obviously, the more proactive do I want to be with initial treatment in this particular patient. When patients enter secondary progressive MS, so when they transition from a phase of their disease where they are stable to a phase where they are starting to develop disability independent of appreciable relapses, this really becomes the last, or I shouldn't say last, but it becomes one of the points where I have one more time a chance to control the disease of the patient before really the socioeconomic impact becomes even more important, because individuals are no longer working, individuals are care dependent, individuals may potentially even have to transition into a situation of where they are cared for by staff in a nursing home. So early secondary progressive MS is, if I recognize this in a patient, is one more time where I want to have most effective treatment. Obviously, this is not the point where I would like to introduce it, it's much earlier, but rather than to kind of say, well, you have now secondary progressive MS, let me step back because, you know, this is it. This is really one more time a point where we can try to control the disease to the best that we can. And here it's important to look in the patient's history, what medications has the patient been on, and to try modes of actions that this patient has not been on. Also think about the fact that the underlying immune response may change in secondary progressive MS to become more driven by the innate immune system. And then as a specialized practitioner, think about which one of the agents may potentially afford a better control of the disease at that point in time.